This is about a product that saves lives. I'm Robert. I work in the field of biosensors. I'm a full professor at Ben-Gurion University and an adjunct at NTU. I will share how we do it, what's in it for you, and how your support and contribution can make a difference. Dengue is a burden on lives, families, healthcare, and the economy. Dengue hemorrhagic fever actually kills. Patients often ask, why is there no DHF-specific test to help me out? Our mission is to help you detect early DHF before it is too late. And we're talking about these 500,000 cases a year. What if we now have the solution for DHF early detection, early screening? Really? Because we provide the doctor with a tool which will help predict DHF before the patient is sent back home, thereby reducing overall healthcare costs and possibly death. So how do we do that? By providing the clinics a tool that not only identifies dengue, but also helps predict it if DHF may occur. How so? With our proprietary sensor, which combines two great technologies, which are well known: the convenience of lateral flow, such as you'll find in the pregnancy test, and the quantitation of electrochemistry, which you'll find in the well-known glucose meter. Together with our patented proprietary formulation and know-how in DHF-specific biomarkers. Our value proposition combines features not found altogether in the competitors' products. And one of the strong features we have, the others don't have, is this quantitation in the quick test. And our customer segment is basically on-site diagnostics, which we hope to first provide to the clinics, then the hospitals, and of course the GP, and maybe one day at home. Well, our revenue model is simple. We sell the test strips and maybe give away the reader. Our go-to-market strategy is that we're relying on the crowdfunding to give us an early kickstart in this. So how can you be involved? Well, crowdsourcing, of course. We need crowdfunding for our dengue DHF diagnostic and seek a backers pledge of $1.5 million. What for? Well, to take our prototype to the field that we can see done within 3 years. You will make the difference. Get this diagnostic to the people. Thank you.
What is the current practice to diagnose dengue?
Excuse me?
What is the current clinical practice? When can they diagnose it and how?
It's done either in the clinics or in clinical labs, or there are some fast tests, but it will only tell you if you have dengue. It will not tell you if you had a secondary infection, which will mean that you can get severe possibility of severe infection and death. So it's up to the doctor to decide, would he send you home, not to fill up his hospital or not.
Right, but is he ordering this test or she ordering the test based on a clinical presentation, or just because they're in the office for another reason?
There's some symptoms, and the doctor with his experience will decide if there may be or not a possible dengue, and then he will order the test, yes.
And in your situation?
In my situation, he will order the test, but if he has the one we have...
Whatever they're there for.
Excuse me?
Whatever they're in the doctor's office for. Or only based on certain presenting
If he sees
symptoms.
there may be dengue, then instead of, let's say, ordering the test that exists today just to confirm there's dengue, he will take our test, and then he will know if there is a possibility of dengue hemorrhagic fever, and therefore, instead of sending the patient home, he'll keep him in the hospital. It's all about keeping the patient in the hospital instead of sending them home.
I'm just not clear about how you've improved on present practice.
Well, if they send them home, they will maybe get much sicker. In the case of Singapore, it's not such a big deal because it's a 1 hour way back to them. But most of Southeast Asia, the patient may die or may get very sick. And dengue, you need to actually treat the person early. If not, you'll get severe symptoms, and then they will die.
The present test, how is that used?
What? The present test, there's no clue. Send them, unless they know they had dengue in the past, then chances they will just keep them there, just in case. But if they don't know if they had dengue in the past, which is like most cases, they'll just send them home and hope for the best.
Thank you.